Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers Podcast. I'm excited to be sitting here with someone that's making a lot of noise that you may not even know. You may be hearing the noise. You're definitely hearing the noise, and you may not know that the man behind the noise is Henry Stoneley. And the noise that I'm referring to is the inaugural year of Health Europe. Everyone in the U.S. knows Health. It's Health, Vive, all over the place. And Health is going global. It is moving to Europe, and they're doing their first year. And a lot of that comes down to Henry. So Henry, thanks for joining us today.
Lovely to be here. I'm not sure I can claim full ownership of it, but thank you. It's very kind.
Let's kind of jump right in. How did you get into the conference space, and why Health?
Great question. So Katie Fryatt, who's our MD in Europe, and John Weiner, CEO of Health globally, got in touch with me just over a year ago and asked if I'd be interested in joining Health. And I said no, because I really don't like events. And then I explained why I don't like events, and they counter-explained why Health did that differently. And it was very compelling. And so I said yes, and I'm delighted that I did. It's pretty much the only event I'd worked for. So that's how I got into it. It's been a whirlwind first, I think it's 12 months next week. So the first year has been crazy, but in a really good way. And we are now 9 weeks, as we record this, 9 weeks and 3 days out from the event. So, yeah.
Awesome. So let's double click on that for a second, because there's 14,300,042 conferences in healthcare. I'm pretty sure it just went up. There's another one. But there's so many conferences, and you guys obviously in the US have managed to really hold a top, at least one of the top slots as far as most popular, most attended, etc. You mentioned that you wouldn't really work for a conference, but something convinced you that this is unique, this is special. And so what is the secret of Health? How do you guys continue to remain unique?
I mean, aside from having a genuine live unicorn, there were two things really. So my reasoning behind not enjoying events is that I come from a dual comms and commercial background. And from a comms perspective, from a content perspective, most events, the content on stages is sponsored. And that means that you get the same people who've got the same deep pockets going up on stage to give the same quite tired presentation where they're usually just selling to you. And as someone who has not worked on the purchasing side of healthcare, I've always been on the selling into healthcare kind of side. That's a lot of the time quite useless to me personally, but it's also quite useless to usually more than 50% of your audience. You've got it's always a guy, right? Like something we can address maybe later, but there's a guy standing on stage telling you about how amazing his company is and how amazing his product is. And 90% of the people who are sat there cannot do anything with this information. It's a waste, and that's a waste of everyone's time. And one of the things that I think probably get the most irate about in life is like time wasting. And so that was number one. Sponsored content offers very little value to anyone, and it doesn't offer value to the person who's paid for it. Like they're standing on stage pitching to 90% the wrong people. Why? So there was that. The whole premise, the pretext behind going to an event is that there's listen to our great speakers. They might be great speakers. They might be amazing individuals with fantastic achievements. But if they're doing just sales pitches, it's not worth it. So that was it. I explained that. I was like, I couldn't bring myself to put words to that. And the second one was a commercial thing, really. I sold into the NHS, the UK's health system, for the best part of 10 years, which is why I look 20 years older than I am. And from a commercial standpoint, most events are really weak because you'll be one of, say, 50 to 500 sales directors at that event. And those 50 to 500 sales directors are trying to find the 50 to 500 buyers who are at those events. And so what happens is you're all trying to find the same guy or woman and you're just running around the conference center for 3 or 4 days searching for this person. I've pitched to people in the bathroom of conferences. Like, I've seen them and been like, all right, well, this is my only shot, because I've seen a competitor outside the bathroom door who's like politely waiting for them to leave and finish and wash their hands. And I'm like, no, we're going to have to do this while you're washing your hands. I'm sorry. Like, the whole setup is not designed for actual senior leadership to senior leadership commercial discussions. And so on that pretense, like on that kind of setup, or within those setups, there's never been like a space where I've thought, this is a really good use of company budget. Like, let's go spend $100,000 or 100,000 euros on going to this event where I'm going to be chasing men into the bathroom and then listening to other men talk about things that I can't influence and have no interest in. Like, that's a bad week for me. So they then explained the Connect program. Katie and John explained the Connect program to me, and it clicked. I was like, okay, so there's a way of making meaningful, quick, waffle-free commercial connections, as well as content that is completely removed from people paying to do it. I was like, annoyingly, because I like being right, they managed to destroy my only 2 objections to most European events in like 4 minutes. So yeah, that was it. And then I obviously had to, it's a job interview. You have to be kind of coy and play it cool and be like, yeah, well, maybe, or whatever. But I was sold by the time I got off the first call with them, because I'm not a natural negotiator.
That's awesome. So what is the Connect program?
It's a great question. So the idea behind Connect is that we bring leaders from payers, providers, and pharma, and employers as well, although a much smaller market in Europe. We bring them to health on a complimentary ticket, and they take 8 tailored meetings with solutions providers. So it might be a workforce management platform, it might be an electronic health record, it could be some form of like service rather than product, loads of different things, all the different things that people sell into healthcare. We take them and we ask the solutions providers to tell us what they do, a little bit like a dating app. And we ask the buyers, the payers, payer, pharma, provider kind of leaders to tell us what they're looking for now and in the medium term. And then we have an AI system on the back end, and also a lot of human input, because we know the nuances of these different markets, and we match them up. And so the providers, for example, they take 8 meetings, 8 15-minute meetings with suppliers who can actually solve their challenges. 15 minutes is not enough time to waffle, to kind of talk about, how are you? How's your dog? Like, great, all the kind of classic boring sales stuff. It's enough time to go, we know that you need a new rota system for your doctors, and that you're really struggling with that as a healthcare system, and this is what we do. If there's an interest, then those conversations continue outside of health. It's generated huge amounts of money for US startups. We're doing it in the US for a few years, and it's a much better way of doing sales. Like, I've had sales teams that I've managed with 3 or 4 people just doing cold outreach, like just constantly doing cold outreach and trying to find the right people and trying to find out what their interests are and what they're buying. And that is a terrible use of resource and their time. And as someone who started their career doing that, albeit in a different industry, unbelievably demoralizing. Cold outreach is probably one of the worst jobs you can do in the corporate world. So yeah, it's a much better way of doing things that puts senior leaders next to each other, one with a problem, one with a solution. If it's the right solution to that problem, fantastic. If it's not, that's the end of that conversation. But at least both sides know, all right, we don't have to talk to this person anymore because they're looking for something slightly different. Perfect. Everyone gets it.
That makes so much sense.
Yeah, right. Like, when Katie and John told me about it, I did a little bit of crying, thinking about all the hours of my life I'd wasted. But it was a video call, so I did it off camera. And then I was like, yeah, that's really sensible. I can't believe no one's done that. And, imitation is the best form of flattery. Since we announced we were doing it in Europe, 4 different events in Europe have said, oh, we're doing this as well now, which is great. Like, I'm very proud of people wanting to copy our already successful model.
Yeah, that's incredible. So why Europe? Why are we bringing health over and going global and moving over to Europe?
Great question. I mean, there's never been a I think actually, let's start that one with, I don't think we're bringing health over. I think we're taking the DNA of health, like what's made the US so successful, the incredible brand that's being built, the fact that it is a place for like the most senior people in your organization, that like sense of, I suppose, security around if you are a hospital health system CEO, you can walk through health without 40 salespeople harassing you. Like it's a place for the most senior people. We're taking the DNA of it as an event and then making it very European. So our total like US audience will be like 10, 12%. And the rest is kind of from maybe 15 tops. The rest is from Europe and the rest of the world. So the idea is that in Europe, there is not a big senior leadership, pan-European, pan-healthcare event. There are very specific health tech and VC or life science and biotech or government events. And there are big pan-healthcare events for sort of the more sales like orientated ones. There's not a pan-healthcare, pan-European senior leadership meeting. And what we've really discovered with the pandemic is that healthcare doesn't really care about borders. It doesn't really get like, there's at no point going to be a virus that gets to the Alps and is like, oh, no, going into France. Like we're gonna stick on this side. So we need to be talking about it as a continent, and we need to have much more joined up strategic thinking and to look into neighboring markets to see what we can learn, what we can cherry pick from them to take back to our own countries and go, France are doing this and it's saving X percent of time or Y million euros a month. Like we should be looking at these things, and we don't do it well yet, but we will.
Okay, I have so many follow-up questions, but I want to touch on something maybe a little technical, but I'm curious about. You come from, like comms, an operating background. How did the brand translate over? Like it's a very strong brand in the US, but like you mentioned, the two, the healthcare, the point of doing Health Europe is to really bridge the gap between the US and the rest of and Europe. How did it translate? Did it translate over well? Did you have to rebuild it? Like, did people actually care that health is interesting in the US?
I think it's a really, really good question. I think the branding in terms of the look and the feel and the whimsy of it, I think the way that we word things is slightly different. I think it's pretty similar. You obviously have to tailor things slightly to European, but actually health is a massive brand in the US and has pretty good recognition in Europe, but not strong enough in Europe at the time that we launched that people were like, understood our color palette or the way that we talk about things or how it looked. And that made us feel both, we're really lucky because it made us feel both fresh and new and innovative, but also for those who knew, it had an element of like, okay, this is like, we know this, we know what it is. So it was fun. It made a bit of a splash. It does look nothing like any other European healthcare event. There's like I think maybe some kind of law in Europe that if you are a healthcare event, everything has to be blue, which is great because it's really easy to differentiate between you mentioned 23 million events, and they're all the European ones are blue. It's nice to think that we've got something that's a little bit more out there. We've certainly seen other organizations, other events sort of aping that in certain ways. And sometimes what a sector needs is a little bit of a kick, a little bit of like someone to come in and go, you can do this differently. Like we don't have to do a boring venue in a second-rate city with everyone wearing grey suits, walking around, muttering very... Like you can enjoy these things. It's okay to go to work and like enjoy work. It's okay to go to an event and travel to an event and meet new, amazing, wonderful people and enjoy that. Not everything has to be, a couple of hundred people stood in what looks like a community swimming pool, kind of nodding while frowning. Like that's not. We tried that. We tried that thousands of times. It doesn't work. It doesn't move anything forwards. It doesn't change things. Let's try the other way. So yeah, it's been good. Reception's been very
all right. Well, first of all, I think that you should carve out some time for yourself to do maybe a little stand-up routine about conferences at Health. I think it would absolutely kill. You're hilarious, first of all.
Thanks. I think I'd get very fired, but I very much appreciate it.
All right. Well, then we could do an offsite. Just we'll do it underground. Yeah.
Yeah, as long as it's chat, it's fine.
So let's talk about now some of the differences between Europe and the US. And so something that I love to do on the channel, and I've done a lot, and my favorite place to go is DC, because DC has so many tourists from all over the world. And on the podcast, I get to talk to incredible CEOs and policymakers and executives in the US. But then I also love to just go out on the street and talk to humans, like humans that are the consumer of healthcare, and talk to different people from around the world about the different models that are out there. And I've had the privilege to talk to people from really all over. And it's really fascinating to me, the entire dynamic of different countries and the way that they operate their healthcare system, and the way those people perceive other systems. And so before I give you all of my opinions, what would you say is how do you think Europeans look at the US health system?
Really interesting. I think it's, I think the most important thing to do, and we haven't got time because we've got like an hour, but you and I can sit down on the Thursday of Health Europe. We'll sit down in a cafe somewhere in Amsterdam, and we'll go to town on this because it's my pet subject. I think when you think about Europe, if you just take the EU nations, you've got nearly 30 different health systems and different perspectives, and there are loads of different things that play into how we think about other nations' healthcare systems, from like the more macro political relationships between Sweden and the US to like your own national perception of what healthcare should be, how it should function, whether you had socialist governments in the background, whether your predominant government post-World War II is non-socialist. Like there's so much stuff that goes into it. But I think that if you were to go to the man or woman on the street, the person on the street, and say, what do you think about US healthcare? They would probably, I think it's fair to say, stick with two things that are constant themes in European literature and European news when we talk about US health. The first one is cost. There's always this, like, it's prohibitively expensive. People go bankrupt. It costs $20,000 to get an ambulance ride. It costs $1 million to give birth. Like these inflated, wild figures that sort of don't take into account a lot of the nuance within US healthcare. And the second word that would come up is quick. I think if you went to a lot of the European systems that are really struggling, because the most of the media that we see that comes out of the US does not focus on rural and underserved communities where healthcare delivery can be slower. It does not focus on more impoverished communities where, again, delivery can be slower. It focuses on the cities. Those are the things we see the most in news media. And so when people think about it, they think expensive, but like if you need to go and see a specialist, you're going to see a specialist. Like if you've got insurance and you need to go and see an osteopath, or you need to go and see some form of eye specialist, whatever it is, like it's happening. If you need to see a primary care physician, that's happening within 24 hours, 48 hours. Whereas what happens in a lot of European systems, not all, some of them are working very well at the moment, but in many of them, what happens is you go, I need to see my primary care physician. And they're like, cool, what weeks are you free in 2040? And you're like, oh, okay, right. Like I'll just die then.
All right.
I think those would be the two things that people think of: cost and speed. And I think there's huge lack of nuance there, but that's generally the perception that we get through media or through, being drip fed bits and bobs about US health over the years.
Yeah. And is there kind of just kind of digging into a little bit, is there any, the urgent care model has been becoming very popular in the US over the last couple of years, or at least COVID has grown it a lot. Is there something like that in Europe? Are there urgent care style centers? Yeah,
we've had them for forever. If I take the NHS as an example, we used to have like 8 different names for them. There were like walk-in centers, urgent treatment centers, urgent care centers, minor injuries unit, which is like, how do you know if it's minor or major? And they've all been sort of mushed together, and they tend to now look, they're technically in the UK at least, they're run by primary care, but they look like secondary care services. So yes, the urgent care models there, we try, I think generally, like most European models, try to triage people via primary care into secondary care. But where there is a huge acute shortage of primary care physicians and clinicians generally, and nurses, urgent care has become the front door to a lot of services when it shouldn't really be. It's what happens if the real front door, primary care, is blocked, right? So it's less of a deliberate part of the model in Europe than it is in the US, but it's become increasingly important by virtue of the fact that people can't get to normal services at the moment because of shortages and overcrowding.
And move over to kind of the pharmaceutical industry for a moment, because I think that's another hot button topic around US healthcare is the predominance of prescription, medications. And a lot of people view the health system in the US as having become essentially just a structure to dispense medication. And obviously, the advertising practices around pharmaceutical companies and stuff like that.
Yeah.
What is the predominance of, do you feel that the health system in Europe stresses more kind of preventive care and lifestyle and diet and things like that? Or do you think it's similar to the US in the pharmaceutical regard?
I think Europe would like to think it's better at that. I don't think it necessarily is. I think we have different relationships with the pharmaceutical industry. So to the best of my knowledge, there aren't many European countries where the advertising of pharmaceuticals on like TV or on billboards is a thing. So I spend a lot of time in the States. I actually got married there 2 years ago. A very classy drive-through in Vegas, solid. With my long-term partner. I didn't just meet someone in Vegas just to be free. So we have a really different relationship with the pharmaceutical industry. So when I was in the States and, waiting to go out something, and I'd turn on TV and there'd be like a 20-minute infomercial about something. That'd be like, ask your primary care physician to prescribe you. You can't do that in most of Europe. Like, it's illegal. So we have a really different relationship with pharma. I think we are the natural thing for all humans to want when they are unwell in any way is a quick fix, right? What anyone wants whether it's a mental health problem or a physical ailment or anything, you just want to be well again, right? And so when systems are overworked and oversubscribed and failing, which many European systems seem to be at the moment, and people are, we're in the UK at least, and a lot of Europe, we're in cost of living crisis. We're in recession in the UK at the moment, which is fun. Always fun to have a third recession in 10 years. Where life gets harder and systems are challenged, I think there is probably an increase in the number of pharmaceuticals being prescribed. I don't have the data to hand. But the relationship is very different. And I don't think it's something that a lot of people twig. I think that if you ask most people what's the biggest problem with pharmaceuticals at the moment, most Europeans, they'd go resistance to antibiotics would be like the big, people are becoming much more resistant to antibiotics and people aren't taking them properly, rather than we're becoming over-reliant on certain types of pharmaceuticals, or that our healthcare system is set up as a sort of primary dispensary model.
Interesting. So I love this mission that you guys seem to have, which is, kind of bridging, creating a bridge between the U.S. health system and Europe. I think it's a very noble cause. And I know you said we could do hours on this, but I'll just touch back to it a little bit, because I think that in a sense there's been a global system, I think, from an innovation perspective, which is interesting, right? And so, one of the people I was talking to, I think they were from the Netherlands, a couple from the Netherlands that I was talking to, and they were talking about how, the health system is great there, and, it's completely free and it's good and they're super happy with it. And it was really interesting because I said, okay, well, the government runs the whole thing, right? And they're like, yeah. And I said, okay, well, that means that the government also dictates how much your doctors make, right? And I said, what does a really good, specialist surgeon make in the Netherlands? And I think the answer was like 200,000 or maybe 150 or something like that. And I said, okay, well, wouldn't you do you have a problem with that, with the fact that that person can't make any more? And he turned to me and he said something I thought was very interesting. He's he was confused by the question. He's like, that's a lot of money. Like, that's a lot of money to live on. And at first I went away saying, there's a difference in culture in the way that people live, and people in the US have a very capitalistic mindset where, you know, if I can make $1,400 billion, then that's what I should be able to make. And that's my right, because if I could create value for all these people, then I should. And people in possibly the Netherlands, definitely this couple, had more of just like a more what's the word for it? I don't know, more, you know, humble kind of life where I can make a decent living and live a good life, and that's all I need. I don't need to kind of shoot for the stars. And so at first I went away with that, but then I thought for a second. Then I thought to myself, 1 second, where does a lot of the innovation in healthcare come from? And a lot of it, if not the vast majority of it, comes from the U.S. And I think that innovation is a product of greed, essentially, or maybe the other way around. But when you have, you know, and maybe greed is the most negative connotation to capitalism, but I mean, even with the most negative aspects to a system that allows for people to make the most money, the idea is that you have somebody that's going to think to themselves, okay, I am poor, I am not doing well. How can I make a ton of money? I have to bring value to a ton of different people, and then let me go and innovate. Let me try to create something, and that really drives innovation. And I think that if you look at it, a lot of, you know, Europe and the rest of the world gets to then, because innovation doesn't stay in within the borders, innovation goes across borders. So they get to basically call Americans, you know, these capitalistic, you know, greedy people that are making all this money on healthcare. But then all the innovation that comes out of the US does get to go through to the whole world. So it's kind of an interesting, I know, just like, it's kind of an interesting dynamic. What are your thoughts around the innovation?
I think, as with all these things, there's definitely nuance to be had here, and I think it's not a primary aim of health, but one of the things that I would love for us to help to progress, at least on an executive level. It's going to take a long time for it to filter out to the general population, but I think is the thing I would love for us to, one of the things I'd love for us to be able to influence is the idea that neither system is perfect, but also that neither system is this sort of evil construct, right? So on the one hand, like, regardless of where you are in the world, whether you're in North America, whether you're in South America, Africa, Asia, Europe, Australasia, it doesn't really matter. Like, doctors and all healthcare professionals, everyone involved in the system should be adequately compensated for, like, the amount of training and education and frankly the critical role, right, that they play in well-being and society and everything else. So there's nowhere in the world really where, if you are to become a healthcare professional, you don't undergo rigorous training and go through constant reevaluation and education, and that is something that should be rewarded regardless of whether you wake up in, you know, like Paris, Indiana, or Paris, France. Is Paris in Indiana? Is that right? That's Paris,
I missed that class. I don't.
Paris, Texas. Don't know what's in Indiana. Never been. Texas, very nice. So, like, regardless of which one of those you wake up in, like, you should be fairly compensated. On the other hand, like, our healthcare systems are structured differently, and so because we have universal healthcare systems, the emphasis is not on making the most money, I suppose. It is on making sure that everyone has equitable access to healthcare, whether you turn up to urgent care in a Rolls Royce or you turn up to urgent care on the bus. Like, you get the same treatment from a public healthcare system, right? It doesn't matter if you get run over by a Bentley or you get run over by a guy on a unicycle. Like, it's the same healthcare that you will receive at the end of the day. Obviously, different levels of trauma, but the idea behind it remains the idea that everything is free at the point of access, or a very minimal insurance cost for you throughout a lot of Europe, and that therefore we can create a more equal society. Now, at the same time, these are some of the most highly skilled human beings on the planet, and certainly some of the most highly scrutinized and highly stressed human beings on the planet. We should be paying them as much as we possibly can, but we're then constrained by public health budgets. So there's this, like, the innovation the US creates, and the fact that you can choose to do something which is ostensibly good for society, which is working in healthcare and helping to make people better, to use the terminology you'd use with a 5-year-old. It is amazing that those people can make incredible sums of money, and that they can be incredibly comfortable and make sure that their children go to good colleges, and that their home is comfortable, and that their loved ones and friends and family are the beneficiaries of their own drive to do good for humanity. And at the same time, it would be amazing if the gap between the haves and the have-nots in America was lessened by, you know, having a slightly more, I think, this is very much my opinion and not the opinion of Healthy necessarily, but like my personal opinion is it'd be amazing if there was a better provision of healthcare for, you know, like Medicaid, like Obamacare, same thing, but lessening the gap between the haves and the have-nots in the US would be amazing. So neither system gets it right, and there's a balance in the middle. But as you alluded to, a lot of this is tied into strong cultural identity around like what it is to be American, what it is to be European. And whilst I think we can create a huge amount of change with Health Europe, and I'm positive that we will do some amazing things over the next few years, I think I'll be picking the intrinsic sort of national traits of on both sides of the Atlantic is probably slightly beyond us, but you never know, we might manage it.
Yeah And listen, you know, definitely creating the platform for those conversations is the best that you can possibly do. And so that's phenomenal. And you know, about the haves and the have-nots, by the way, and this is kind of a small note, but I actually think that the people that suffer worst, it's not the haves versus the have-nots, it's the haves and the have-nots versus the have-littles. Like the people that are just above that bracket, that's when they get crushed with insurance costs and you know, stuff like that. So
winning low level. I see what you mean.
Yeah. But and you know, I think what might be a really interesting focus, and where, as I think it through, where probably, so innovation I think crosses borders. What I think definitely has very, very strong borders is regulation. Right. And so policy and regulation is where the systems are staunchly within their borders. And you know, I haven't thought this through very well, so I'm not going to make I'm not going to give any advice here, but it might be an interesting thing to think about. You know, what if we treated healthcare like, you know, like, I don't know, maybe like the manufacturing industry, where there's different parts of the world are better at different pieces of it. And you can also be better, you know, and these countries are much better at building the small products. And then these countries are better at shipping, and these countries are better at, you know, innovation. That might be an interesting thought, but that definitely would not happen without any ability to amend kind of regulation, which obviously is
We're moving towards better pan-European regulation. So like we have things coming up, like the European Health Data Space, which is sort of being fleshed out at the moment. There are lots of initiatives to make sure that Europe is keeping the stringent checks and balances that we need to ensure that healthcare is safe at the point of both research and delivery, but also that it is easier for organizations, innovative companies coming into the space to work with systems and with patients to deliver the amazing innovations that they're creating without the kind of constant red tape. And it's always going to be a balance. We never want to have a system where it's like, come on in, you've got an app on the App Store, fabulous, go treat a patient. We also don't want to create an ecosystem that is so anti-innovation or so reluctant to try new things that startups run out of money before they get even close to getting it in the hands of a clinician or a patient. So there's a balance.
Yep. Okay, this has been absolutely fascinating, and I'm super excited to come. We're going to be bringing the entire weight of the Healthcare Trailblazers podcast, and hopefully all 7 million views to Amsterdam. Let's end off with a little rapid fire on. Okay, you said that, I think, did you say 12% or 20% of the conference is going to be American?
Let's call it 15 for the sake of
15%. Okay, so let's talk about culture clash. What is Henry's advice to Americans coming to Health Europe on how to not, maybe things that you would think would go in Vegas that would not go in Amsterdam? Go.
I'm the worst single person you could have asked this. So I'm going to tell you a very quick story. Like I said, I got married in Las Vegas 2 years ago, and we did a big road trip around California, and then diverted into Nevada for like 2 days. My wife at the time, my fiance, bought me a Raiders hat, like a cap thing, cap, and I wore that into, what's the San Francisco American football team? Was it the Packers? I can't remember.
I have no idea.
49ers, there you go. It's the 49ers. I inadvertently, I believe the Raiders and the 49ers are great rivals of some description. I wore that into a 49ers bar while I was waiting for her to do some shopping one day. So I'm incredibly bad, even once trying to assimilate into a culture. Doing so, basically spent like 2 hours getting verbally abused by grown men. We became firm friends, and it was nice. But I'm a terrible person to ask that. I would say the Netherlands is a beautiful country full of wonderful people. It has the highest level of English literacy of any European capital that's not London or Dublin or Edinburgh or Cardiff as well, technically capital. So it's a very laid back place. I think people are very welcoming there. I spend a huge amount of my time there, and I've never known it to be anything other than welcoming. So I can't think of anything you could do. I'm not going to say that out loud. I was going to say I can't think of anything you could do in Vegas you couldn't do in Amsterdam. I'm sure that's not true. I just can't think of anything. But it's a super welcoming place. It's super safe. It is the easiest city to get around. Public transport's amazing. If you're feeling brave, get a bike, cycle to the event. I'm not liable if you come a cropper in any way though. But yeah, it's a great city, and you will absolutely love it.
Awesome. All right. Well, Henry, this was a ton of fun. I think it's going to be a really fantastic year. And, most conferences people get to say to themselves, all right, I'm not going to make it this year, but I'll make it next year. But this is a really important year. It's the inaugural year for this event. And so if you're even thinking about participating in Health Europe, I think this is going to be a one-of-a-kind year. And this is going to be the year that Henry and the team will be able to try a bunch of things and make some mistakes. So it might be a ton of fun, and things might go crazy. And the next year they'll be like, all right, we're not going to do that party. That was nuts. So this is the year. This is the year to show up, I think.
It's going to be great. And it, as you say, you're completely right. It's one of the best things about working for health as a wider business, not just Health Europe, is that the attitude towards trying new things is like, yeah, go make it happen. If you can make that happen, make it happen, and then we'll evaluate it afterwards. And I think that's the sign of an organization that genuinely wants to help healthcare and isn't concerned about like margin and all the rest of it, the boring metrics that most events are constantly whining about. It's an organization that goes, go make it happen. We'll make it a success if we can. And year one is going to be the weirdest year for that, which is great.
Awesome. Well, Henry, thanks again for joining. For those that want to register, it's europe.health.com, health spelled HLTH. And I look forward to seeing everyone there. Thanks for joining us.